Avogadro's number is not relevant in homeopathy per se, because you pass by molecules themselves all the way down to energy. The physicists have proven that the molecule level is really, far up here. And we've got this, and we've got, I don't even know the names of them, quarks, and we've got this and this and this. They keep discovering that molecules are not the last of the set.
There's a lot of so-called scientists who go around telling people that homeopathy can't possibly work, therefore it does not. They base it on basically a scientific fact that the homeopathic remedy does not contain any active chemical molecules. So they say there's nothing in it, therefore it doesn't work, therefore we don't want to look at the data. That's the controversy. So they say it can't work, therefore it doesn't. I say you think it can't work, but it does in my experience. So just come and look. If you don't look, you don't know. There's studies to show that it does work. The double-blind placebo-controlled trials are very straightforward. They're done very rigorously, just like any drug trials. And they do show a difference, which cannot be explained by science. So often in the end of the trial, in the end of an article describing such a trial, they say, well, we don't know why this happened, therefore maybe it's a fluke or a mistake. It's not very scientific.
I love working with critics and people who are, what would you say, skeptical of homeopathy. And my message to them is, that Douglas Adams in the Hitchhiker's Way to Galaxy, or that book, he says that the scientist is the one who keeps the mind open, and sees what changes can happen. And if you're not being helped, yes, you're free to keep that opinion that, okay, homeopathy doesn't help, but if it does help, it can change your life, and so you should give it a try.
Yeah, somebody who is a critic first needs to get his data. Okay, as Mark Twain said, get your facts first, then you can distort them as much as you please. Okay, but they basically don't have the data. That's the bottom line. Everybody who is a critic has not looked at the information.
I like to tell the story when I'm teaching about my dad. My dad was a good German farmer, never sick a day in his life, literally. He's 88 years old, and his brother dies. And his brother's his best friend, his fishing buddy, for 88 years. They were a year apart. And he calls me up one day and he says, "Marylu, you got any of those little white pellets? I got a bad problem." I said, "What's your problem, Dad?" And he said, "I can't walk. My knee, it gave out. I can't walk." I said, "Well, did you fall?" "No." "Did you hurt yourself?" "No." "I can't walk." Well, of course he's frantic. He couldn't walk. Terrible pain in his knee. So I said, "Go to your doctor, have it checked out, Dad. I'm 2.5 hours away. I'll be right there. We'll see what goes on. You tell me what they say." He takes himself to the doctor. They do x-rays, blood test, find nothing. So he says, "You call my homeopath. I've got to talk to him." I said, "Fine." We call the homeopath, and in the meantime, before the remedy gets there, he goes down to another doctor, has another set of x-rays taken, a specialist. And the specialist tells him that he should have his knee replaced. It's old and worn out, and that's the problem. And my dad sits up in the chair and says, "What are you talking about? My knee's worked good for 88 years. There's got to be something else. It's just not worn out. You just don't start having pain when you wake up in the morning. I would have known about it. I was just out on the tractor the other day." So he takes his remedy, And of course, 2 weeks later, his leg is fine. This was an old German's way of grieving. You don't talk about your brother that you miss terribly. You don't cry about it. You go to the funeral and you go back to eating your Wheaties and coffee for breakfast. What happens to that kind of grief? Landed in his knee. For somebody else, it might have been a migraine. For somebody else, it might have been a sore throat. So the remedies can impact the whole of the person. And that's what happens.
If, for example, you have some lethal condition, for example, diabetes is a lethal condition, and giving people insulin saves their life. Okay, so if somebody has bad infection, we can give antibiotics, kill the bugs, save somebody's life. Okay, so that's the extent of what conventional medicine does. In most chronic cases, it's palliation, which means they are sick, they're given medication to feel better or to bring their blood pressure down or to achieve whatever effect. And the medicine works for as long as it's in the system. In homeopathy, what we try to do is to debug the system so the system can actually cure the problem on the physical level. So we're looking for an actual permanent improvement, or in some cases a cure, if we're successful, which in my practice happens on a regular basis. And so if somebody is on a palliative therapy with conventional medications, we add homeopathic remedy, we make sure that they are improving, then we slowly start reducing the conventional medication if it's tolerated, and eventually, hopefully, remove it, and the patient is fine without the drug, because now their system works a lot better and we don't need to palliate anything.
To me, the client taking charge of their health, making a decision what they want, because that's the state we live in, this era that as a consumer, as a customer, as a client, you have a choice. And if your choice is to be on the meds and deal with it that way, great. If it's not, you want to really integrate and work with more naturally, holistically, and that's where I come into play.
There is a good reason and a place for conventional medicine, absolutely, without a doubt. I mean, emergencies, even now, if people don't know about alternative health, and you have an anxiety disorder or migraines or any kind of life-threatening or symptom that is, needs treating, Western medicine has been a great gift.
So I think I'm hoping, where, chiropractic and acupuncture is much more, should we say, accepted by the modern medicine now. So one day homeopaths will be accepted too.
It takes a certain person, as I've learned, to actually start using homeopathy. It's not for everybody. Somebody needs to understand on a fairly deep level what it is they're trying to treat. Most people are not looking for really deep improvement. They're looking to get better tomorrow, and they don't care how.
Considering alternative medicines as possible solutions to problems or conditions that people have is becoming not alternative anymore. It's just becoming part of life. If something doesn't work, you're going to look for something that does work. Whether it's Western or what we are now calling alternative, and switching to complementary, because it's not either or anymore. It's finding something that makes you feel well.